Welcome to the Brains and Needles podcast. So, there comes a patient who is 67 years old, complains of hearing loss, and has severe pain in the bone, which is known as bony pains, and also had multiple fractures over the years. So, what is this disease? Let's dig deeper into it and know the disease and thereby also treat it and diagnose it. So today we are going to talk about Paget's disease of the bone. So Paget's disease is a disease that disrupts the replacement of old bone tissue with new bone tissue. So basically what happens, there's a good balance between the bone, there's a good balance kept maintained by the bone in formation and its replacement, like the formation of new bone and replacement of the old bone. So in this disease, this balance is disturbed. So, so basically, if I put it structurally, so it is a disease that disrupts the replacement of old bone tissue with new bone tissue. So basically, it will occur in pelvis, skull, spine, and the legs. This condition can be symptomless for a long time, and so we'll just dig into it. So it is a chronic bone disorder that typically results in enlarged deformed bones due to excessive breakdown and formation of bone that can cause bones to weaken and maybe result in bone pain, arthritis, deformities, and fractures. So now let's jump into the types. So if let's say a single site of bone is affected, so we call it monostatic. And when multiple sites of bone are affected by the disease, it's known as polystotic. So, what are the risk factors? The risk factors being age being a factor where, if your age is above 40 or 45, it can be a risk factor. It can be triggered by paramyxoviruses, infections, measles virus, etc. Also, it can be linked to some genetic mutation, like there is a specific gene SQSTMI or M1, sorry, SQSSTM1. So these are the some of the risk factors. Although its etiology is unclear and unknown, why precisely it causes or what is the precise cause of the disease. So, like, we don't know the cause, but we can always know the signs and symptoms. So, the patient comes and he complains, or when we look up to him, you can see the patient has damaged cartilages, which he complains of difficulty in movement and pain in his joints. And there some parts, if you see the patient complains that this bone is enlarged. The patient complains of broken bones. It's have fatigue due to this. There can be hearing problems, numbness or tingling due to pressure on the veins caused due to this activity. There can be curved backbone, so you'll see the patient is very humble. Not making fun of it, but the patient's lumbar vertebra is affected and it bend inward, so the patient appears as if he's very humble and bowing down to us. It's actually caused due to this disease. There can be bowed legs, so the legs being the weight bearer of the body, so the bones of the legs will be bowed, and they'll look as if they're reduced in height because the legs are bowed, lumbar vertebrae you know is curved, so the total appearance will look like the patient is reduced in height, certainly. So what are the complications? Before complication, let's jump back to the physiology or the pathophysiology of it. So there are, at the cellular level, there are two cells, osteoblast and osteoclast. So osteoblast is related with formation of the bone and osteoclast is related with replacement of the old bone. So physiologically, it is present in a balanced way, whereas new bone is formed, old bone is replaced, so there's no problem. But in this case, what happens? Now, osteoblast usually, through its receptors, activates osteoclast, and osteoclast does its osteoclastic activities, which is replacement of the bone. All replacement of the bone, that is by destruction. It releases products and causes destruction of the calcium phosphate. When the calcium phosphate is destructed, at the same time, the osteoblast again gets activated and causes bone formation. And this formation of bone occurs after a dearrangement or a deformed structure is formed by the osteoclast, and on that the bone is formed. So the structure in the end which is seen or formed is very deformed. There can be overgrowth at one. It is not uniform at all. It's just like the roads present in roads present in our city. So that can be the best example if I can give. Like a road is smooth and suddenly a potholes. It's just like that. And later, due to this, there can be formation of sclerosis, because after bone replacement and formation, replacement and formation, there comes a time when in the end stage, where there is sclerosis in the part where there is this destruction and bone formation, because they are replaced by fibrous tissue now. So this happens in this case. So this new structure which is formed, because the reabsorption is low whereas the formation of bone is high, the new structure formed is really weak from the original bone, which is usually formed when these both are in check or in balance. So as I mentioned early on, the patient won't have any symptom. The patient can be symptomless. But as the time progresses, over time, due to mishappen of this bone, can impinge on nerves and cause pains. Can cause fatigue, and it affects the bones of the ear, the three small bones, if you can name it in order correctly. So if the smallest bone in the ear and all those bones, smallest bone in the body is present in the ear. So when these bones get affected, there can be hearing loss, and it can also affect the optic nerve due to this activity, and can cause loss of vision in some cases, not always. So what can be the complication due to this wear and tear, this reabsorption and formation, overformation of bone? It can later cause or transform into malignancy, which is known as osteosarcoma, the cancer of the bone, which is in this case due to the Paget's disease, because it was initially the Paget's disease due to which the wear and tear happened, and then it turning into the malignant state. It is known as Paget's osteosarcoma. So there can be formation of kidney stones, spinal stenosis, paraplegia, you know, hydrocephalus. Also, there's a good point to remember. There's enormous amount of calcium present in the blood, sorry, which can lead to constipation, depression, drowsiness, and tiredness. This point I mentioned, I will explain this elaborately in another podcast where I'll talk about hyperparathyroidism, where you'll come to know how calcium acts and how it progresses and how all these symptoms occur. But for now, just remember the calcium level going high causes constipation, depression, drowsiness, and tiredness. So for test and diagnosis, the go like in for if anything concerned with the bone, first you'll do the X-ray. So in the X-ray you can see the deformities. You can differentiate between the normal and the affected part. If it's monostatic or polystotic, you can classify them. Also, you can show the difference between a bowed bone or a curved lumbar spine, and you can differentiate it. A blood test is usually done to see serum alkaline phosphate. Alkaline phosphate is an important serum which is a indicator of formation of bone. Whenever there is bone formation, there is increase in alkaline phosphate, and whenever there's destruction, there's decrease in alkaline phosphate and increase in hydroxyproline. I'll explain what is hydroxyproline with when I explain the physiology and pathophysiology of calcium, like calcium, increasing or decreasing, which is hyperparathyroidism and parathyroidism in the other podcast. So just remember for now that Whenever bone damage is there, alkaline phosphate will decrease. Whenever there's bone formation, alkaline phosphate will increase. With and when there's bone damage, there will be decrease in alkaline phosphate and increase in hydroxyproline. If I'll give a gist, what happens in the bone? There is collagen type 1. So in this collagen, there is this hydroxyproline which is present on this collagen. So whenever this bone formation, bone damage, this collagen also gets damaged, and from this hydroxyproline is let out and goes into bloodstream and eventually is excreted from the kidney. I'll tell you about it in detail in another series of podcasts where I talk about parathyroid hormone. So bone scan. You can do a bone scan, to know the activity of disorganized bone. In this scan, you just give a radioactive substance, inject into the veins, and you'll know if it's Paget's disease. You can do a bone biopsy to rule out malignancy because, as I talked, it can transform into osteosarcoma. So Paget's osteosarcoma can be present. A urine test is usually not done for find the disease, but it can help us knowing the amount of calcium is how much calcium is present, and other substances which can help us to diagnose the disease. And some bone markers can also give us information about the disease. I forgot to mention one thing. When you look, the skull is also affected. So in this part, the skull looks really weird. The skull will be the face of the patient will look really disshaped or misshaped. It will look like leontiasis, the overgrowth of skull bones. You'll see jaw, the jaw become very wider. Even your upper skull, all the bone is wider. The face becomes larger. Optional leotiasis. So that is also there, which I forgot. So now let's move on to the treatment. So now let's talk about the treatment. So treatment medication is usually to counter the pain, like paracetamol, ibuprofen, and there can be oral medication which can be given like alendronate, teludronate, risedronate. The best anti-reabsorptive medicine being bisphosphonate. You'll always see a doctor giving bisphosphonate, which is the best medicine because it's an anti-reabsorptive medication. And there can also be done given, you can give in injectable medicine like zoledronate, pamidronate, or calcitonin to you know to work with the calcium there. Surgery. So fractured bone is like connected by joining the broken bones together by some stainless steel rods. You can if correct the bone deformities, and to alleviate the nerve compression due to the bone enlargement. Surgery used to remove the bone from a squashed nerve, So, and so that's all. So let's go back to the patient. The patient we are talking about, he came in 67 years old, has hearing loss, has multiple fracture. So what we do a CBC, total blood count, where we'll see increased calcium. We'll see in the blood biochemistry. We'll see increased alkaline phosphate 3 reactive protein, being a sign of inflammation. In urine, you can see lots of hydroxyproline because it is excreted out a lot. So, and this patient is treated with bisphosphonates, and there's some minor surgery to correct his bone deformities, which is the pelvic region, because there was large formation which caused the patient to limp, and there's extreme pain into the lower back. So yeah, that's all about the Paget's disease. In the next or the further podcast, we'll have a detailed podcast about hyperthyroidism, hypothyroidism, parahypothyroidism, and parahypothyroidism, and many more subjects to come. So stay tuned. We'll also have podcasts in many other languages, and if any one of you is having some idea about a podcast, please send us DM us on Instagram or messages on Facebook. Thank you.